Hey, did you guys hear about the guy that was so ill he had to have the whole left side of his body cut out?
No.
No.
Well, he's all right now. Oh, hey, you guys were kind of eavesdropping us. We were just telling a little healthcare humor there, but thanks for joining us. This is the Whole You podcast presented by Nebraska Total Care. My name is Dr. Chris Elliott. I'm the Chief Medical Officer for our health plan here in Nebraska, and we're so happy that you joined us. Nebraska Total Care is a health insurance plan, and we have offices throughout Nebraska that will just help us cover you wherever your needs be in whatever part of the state that you're in. Our purpose here is to come alongside you and to really support you and your family in all of your health care needs. We want to be your trusted advisor here in the state of Nebraska for your health care. So I have with me today Adam Proctor, CEO and President of our health plan, and Nancy Laughlin-Wagner, our Chief Nursing Officer and Vice President of Population Health. Thank you for joining me.
Thanks for having us.
Absolutely.
First podcast is going to be directed towards how to use your health plan and all the benefits that we have for you to utilize and take advantage of here to help your health. Please tune in each episode because we're going to have a whole series of these podcasts, and we're going to help you learn about diabetes, blood pressure, heart disease, how to take care of yourself during pregnancy and maternity care, and several other topics. So you won't want to miss any of these. My background is emergency medicine, and for the last 30 years or so, before I came here a few years ago, I was an ER doctor in the hospital. My passion is really in prevention and helping others to understand that lifestyle changes, diet and exercise can really make a big effect on your long-term health and vitality in the short term as well. So for our first chat, we have Adam and Nancy, and we're going to talk a little bit more about Nebraska Total Care and just what our insurance plan has to offer you right here in Nebraska. Adam, tell us a little bit about what gets you up in the morning and makes you run this company.
Yeah, absolutely. Thank you, Dr. Elliott. And I'm excited to be here for our inaugural episode of our Whole You podcast. These types of events are part of my passion and get me up in the morning to share our mission and our core values. Our mission is right here for everyone to see, kind of transforming the health of our community one person at a time. And, you know, that's truly kind of our passion and that's what drives me, is to get up and help Nebraskans in all lines of business, and even Nebraskans who aren't with Nebraska Total Care in some way, shape, or form, live a healthier life, have access to quality healthcare services, and receive the care that they need. We've all have families, we all have people or friends in our lives who have been touched in some way by a medical need, no matter whether it's preventative, invasive, or severe. So what we have to look at is we want to get the right care to the right people at the right time. And if we're able to do that and help people across the spectrum, then we're living that mission of transforming our community one person at a time at Nebraska Total Care. And that's our passion. That's my passion. That's my why. And that's really what drives me every day to come in and serve the community the way we do.
Thank you. That's fantastic. And I know that you started your healthcare career in the behavioral health space.
Yes, I did.
You were a provider here in Nebraska, took care of literally thousands of Nebraskans and really helped them through their mental health challenges and so forth. And so you're really positioned well to help our members in that respect as well. And I've seen that in your leadership style throughout our plan too. So really appreciate that.
Yeah, absolutely appreciate it. And yes, behavioral health therapist by trade. Enjoyed working in both the community behavioral health and private practice worlds with that right here, primarily in Lincoln. I love that we can have a statewide reach now with all of our products. We have a marketplace product with Ambetter from Nebraska Total Care. We have a Medicaid product through Nebraska Total Care, and then our WellCare Medicare brand product. So we can really impact folks throughout their lifetime with any one of our products from Nebraska Total Care. And that statewide reach, again, is really a passion for me.
And now I'm going to turn to Nancy. Nancy Laughlin-Wagner is our Vice President of Population Health, and she leads our care management team, our Chief Nursing Officer. Tell us just a little bit about yourself and what you love about Nebraska Total Care, Nancy.
I will. Thanks, Dr. Elliott. Thanks for having me on the show today. So I'm a registered nurse. I went to school at Creighton University, and I've been practicing in healthcare for about 20 years in various roles, all of them here in Nebraska. But my first role was in the operating room. And in that time in the operating room, it was really one of the values that was really impressed upon me and that I've taken with me through my whole career is the value of teamwork. A person can't have surgery alone. It requires a team of people so that surgery can happen safely and effectively for the patient. And that value of teamwork is something I've carried with me. And I'm really proud to say that at Nebraska Total Care, that's a value here. We work together collaboratively, passionately, and diligently because we really want to give a great experience to our members and to our providers across Nebraska.
Fantastic. Yeah, and we've seen that leadership. Both Nancy and Adam are just such fantastic leaders, and throughout their experience that they bring in the healthcare realm to all of our team here at the health plan, and it's been so useful. And so Adam, going back to you, can you share with us kind of what guides you as the leader of Nebraska Total Care?
Sure. Beyond kind of our core mission, I think we've got our sort of guiding values that we have as a company, which are service, accountability, trust, curiosity, and then the ability to be courageous. And I think all of those things underpin the culture here at Nebraska Total Care. And Nancy spoke really nicely to the fact that our teams work collaboratively. We really have a, one, team culture, one Centene culture, as we call it, with our parent corporation Centene. So we try to embrace that within our culture and values and embrace one Centene right here at Nebraska Total Care across all of our lines and what we do. And I think that is fundamental to what we do and why we're able to be successful, is because we have a group of folks who are mission driven and then live those values underneath that mission every day.
I think that's so true, and I think you've done such a magnificent job of getting that whole idea and concept spread throughout our plan. As I walk around and I talk to all the other employees at Nebraska Total Care, there's so many moving parts to insurance. You have to pay claims, you have to talk to members, make sure that they're seeing the right providers and getting the right health care, that sometimes you just get up in the morning and you work. But when I talk to our staff, I know for sure that they know why they get up every morning, because it's just that individual member. They want to make sure that their health care is maximized and they deliver that awesome service. And so I think you've done a fantastic job of leading our plan in that direction.
I appreciate that. I think, a quote or a story that always resonates with me, kind of to that point, what we're trying to encapsulate here, and I think what you're referencing, is a story from John F. Kennedy when he toured NASA, and he asked a janitor what he was doing in that, what his job was. And he said, "I'm helping put a man on the moon." And that shows kind of, the global focus. He didn't say, I'm cleaning the floor today, or I'm doing this. He understood the broad purpose and the role he played. And I think it also shows there's no small parts. And, from every individual on our health plan through every member of our leadership team, there's no small parts. Everyone has a role to play to achieve the outcomes that we want to have for our members.
Exactly. So are there any other tangible or intangible benefits that Nebraska Total Care offers our members that you'd like to discuss?
I think a lot of people know that healthcare will cover their main core concerns and things like that. And I think for us in our Medicaid product from Nebraska Total Care, it's important that we highlight some of the services that go above and beyond what we can do for Medicaid members. So we have, leaning on the behavioral health piece, we have 5 sessions a year that our members are able to utilize that can help expedite treatment and support care within primary care clinics in other settings where they may be able to, remove any barriers to going multiple offices or any barriers to getting in quickly to receive services. I think we also offer a wonderful maternal health benefit related to a choice where you can, let us know you're pregnant so that we can support, your maternal health journey all the way through prenatal to postpartum care. And within that, if you kind of let us know and we're able to engage with you, you can select a pack and play, you can, or a car seat, or Stroller, thank you. Thank you. I was looking for that third one there. So a car seat, a pack and play, or a stroller. And I think that's a wonderful value add benefit to our maternal health members. And it also allows us to help support that maternal health journey all the way through and ensure that, you know, mom and baby or mom and babies are taken care of throughout, you know, the spectrum of their healthcare needs, even as they move into preventative care. And then in our marketplace product, and better from Nebraska Total Care, I think we do a very diligent and sensitive job creating a benefit package and an affordable healthcare plan for Nebraskans across the state. And we launched that product in 2022, and we have grown substantively over each year. And I think that growth is indicative of a product that is, you know, priced affordably and provides coverage that Nebraskans can utilize and derive real benefit from in taking care of their health. And then with our WellCare Medicare product that we administer here at Nebraska Total Care in the state, you know, we have a dual special needs program for people who are both Medicare and Medicaid eligible. And we're very intentional about kind of how we look at those benefits, and we want to set up benefits that allow people to maximize what Medicare can offer and what their Medicaid plan offers, so that they kind of work hand in glove with one another in those dual programs. And then we have other just straight Medicare programs or Medicare Advantage programs, and those create and bring benefits like a spendables card or other opportunities where they can kind of use dollars or other benefits at point of sale, or even pay at the pump for gas in certain instances. And it's again an intentional piece of what we want to do as we look to be able to cover a wide spectrum of ages and people across the state with all three of those products. And if people should potentially lose coverage, if they're no longer eligible for a certain, you know, product, like if they were to lose Medicaid coverage, they would then have the opportunity to maybe move into, you know, and better from Nebraska Total Care on the marketplace side, or depending their age, maybe a Medicare product. So really creating, you know, a whole suite of products that really can support transition of care where they need to be.
Mm-hmm.
Yeah, that really speaks to kind of how we have developed our products in Nebraska to really reach everybody and not leave anybody out, no matter where they are in the state, what age they are, or what their needs are. So I think that's fantastic. You know, one thing that I never had to worry about in my previous life when I was an ER physician was prior authorizations. And that gets a lot of discussion, I know, with our providers, whether they're doctors, hospital administrators, other type of providers, as well as our members. Can you kind of discuss that for us a little bit, the reason behind prior authorizations and how to navigate that space?
Sure, and you know, I won't belabor the point, and I'll let Nancy, who's probably well more of an expert than I on this, you know, speak to this as well. But you know, for me, it goes back to the idea of right care, right time, right place for people. And what we want to do is we want to ensure that people are getting the services that they need that are medically necessary, and that can have direct impact on their care.
You know, Adam, I think you touched on a really key thing, and that is something happens when we get an authorization for service, and that it triggers a look into extra support one of our members might need. So do they need help getting some special DME equipment? Do they need help? Are they going to be in the hospital for a while, and how are they going to transition home safely? And so the authorization process is a lot, there's a lot that goes into it behind just getting authorization to do the service. In regards to reimbursement, you know, there's a whole quality component that helps us to manage our members.
A lot of times, you know, our members don't realize that with every procedure, every time they touch the healthcare system, there's risks as well as benefits. And so part of the reason we look at those prior authorizations, I think, is to protect our members to an extent as well, that if they don't need that CAT scan that will just give them more radiation buildup in their body, that really isn't going to be useful. They don't really need that, or that procedure where there's a chance of infection or something like that.
Wonderful that you two are here to say all those things much more eloquently than me. You know, Nancy referenced you know, DME in her thing. So you know what you know, just so that people know what you mean by that.
That's a good point. Yeah, DME, durable medical equipment. Yep. So you know, things like braces, walkers, wheelchairs, extra things that they might need to support them in their just everyday life and their mobility.
Yeah, one thing we love in healthcare healthcare is our acronyms,
Oh,
right?
my goodness.
We've got an acronym for everything. So I think it's important when we're communicating our stuff. We talk in that all the time. So it's almost like a shorthand way for us to communicate.
Yeah, I thought I knew them all, and I came to the health plan a few years ago, and there was a whole new set of acronyms that I didn't even know. So it's a fun journey. One more main question for you, Ed, and then I'm going to move over to Nancy for a couple things. But every year the state puts out, the state puts out a provider satisfaction survey.
Yes.
So whether it's hospital administrators,
we administer.
Or we administer
it. Yep, at the state's.
That's
correct.
right. And so whether it's hospital administrators, whether it's doctors we work with, physical therapists, and all different types of providers throughout the state that our members utilize, they rank us on how. Well, you tell us what they rank us on. Yeah, but I do know that we've really been at the top of that list for the last few years running. Why do you think that is, and what really makes us stand out?
Yeah, I think that's something we're really proud of here, and I think that's part of our culture. I think, we do administer an annual survey, and in our Medicaid space, for our Medicaid product with Nebraska Total Care, we've been fortunate enough to be overall #1 in provider satisfaction for the last 5 years. And I think we're rated by providers on a variety of categories, whether it's prior authorization like we were just talking about, or claims, or communications. There's a host of elements there. Really, I think what allows us to do well is that we are responsive, we communicate and provide outreach, we drive resolution. We know that we may not always get it right, but when we do, we're trying to find solutions. And at the end of the day, the fact that we drive resolution, that we're responsive partners, that we've built trust and their confidence that we can get things done, even if we've got to kind of take another look at it, translates to that overall satisfaction for us that we've enjoyed. And that is something that is shared by our entire organization and our entire team's structure and set. Where that impacts members is that if we are providing a positive provider experience and are easier to do business with, that improves then the member experience with the providers as they receive their services, and we want to make it as administratively simple as we can. Healthcare is complicated. We know it can be complicated. So the easier we can make it for our providers, the easier it can be for our members, and then that promotes then that access and allows people to kind of get what they need.
Yeah, for sure. And I think kind of like you mentioned, we're not perfect, but we're approachable. And we're easy to work with, and that's kind of what our mantra is around throughout the state, and that's what we're known for. So that's great. Okay, I'm going to turn a little bit more now to you, Nancy. Okay. And again, Nancy is our Vice President of Population Health and Chief Nursing Officer here at the plan. Now, when we say population health, what exactly does that entail?
Oh, that's a great question. The term population health is really talking about a group of people and how you manage their health. And so for us at Nebraska Total Care, our population is each one of our members. So they are the group that we are managing their health and helping them on that healthcare journey. We do that by making sure people have access to care and services that they need. We want people to have education about preventing illness or support managing chronic conditions they may have. And really all of our work is aimed at helping our members improve their quality of life by ensuring that they can achieve their best health outcomes.
Fantastic. Now, another big portion of your job, I know, is managing, I don't know how many we have, I think 40 or 50 expert nurses that we have in a care management program. And a lot of people don't realize that insurance companies like ours have these services and support systems. Can you kind of talk to that a little bit?
Yeah, I can. Back to my earlier point about teamwork, that just an example here would be our team. So in care management alone, we have pharmacists, doctors, nurses, community health workers, mental health therapists, physical therapists, and
dentists.
Thank you. Yes, I know. I hope I'm not leaving anyone off the list, because it's really a really diverse group of folks that have a lot of education, a lot of experience, and we work together to make sure that we're taking care of the whole person. Care management is, it's pretty simple. It starts with connection. It starts with engagement. And in that, we like to do just a simple assessment. It helps us to get to know our member and maybe some concerns or challenges that they're facing. So, through those conversations, we might learn someone is newly pregnant, or someone is unsure if they're going to be able to feed their family tomorrow. We might find out someone's struggling with an addiction. So whatever someone's needs are, we're here to help. And that's how we do that, is kind of just through question and conversation. Care management's open to anyone at the plan. If you want to be involved in care management, there's a number on the back of your ID card for member services. You can call and ask for care management. And again, it's open to anyone and everyone. What we like to do is help our members set goals. What are the healthcare goals that they want to achieve, and how can we support them on that journey? And again, really, it's just aimed at supporting people, helping them meet their needs, and improving their quality of life.
Yeah, fantastic.
The other thing I should mention really about care management is, we've designed it to be pretty intentional in that we want it to be something our members want. So do they want to talk to us on the phone? Do they want to just simply text and email? Do they want us to come and meet them face to face? However they want that engagement to occur, we're here to meet them that way. So I think it's a great service, and I would encourage anyone to take advantage of it.
Excellent. Were you going to say something, Adam? Or?
I was just going to give Nancy and team kudos. They've stood up a variety of, I think, innovative programs where we'll reach into hospitals and do face-to-face interactions to support discharges. When you're talking about health, I think you all have done a wonderful job, not only just talking about medical health care, but also the social components of health. And if somebody needs housing or has a food insecurity or maybe feeling socially isolated, our care management team is able to help with that, and we have, in some instances, dedicated teams to help with that and help with foster care youth and families. So I think that is, speaks well to our mission and the service and the whole health of our member as we're talking about our Nebraska Total Care Whole You podcast.
Exactly.
Right,
yeah.
and oftentimes we find in these assessments people have more than one concern or more than one need that they need help with. They may be trying to manage a chronic condition as well as facing a housing insecurity, and so we offer a lot of services that will help people on their, physical health, mental health, and their social journeys.
Yeah, we like to think of ourselves as more than just an insurance company, right? And we want to engage our members, come alongside them, encourage them, and help them through this process on their healthcare journey to maximize their health.
Yeah.
And we also know that, those quote-unquote non-healthcare drivers really do affect your health. Like, if you do have difficulty with food insecurity, if you can't find transportation, if your housing is unstable, that really has been shown to be detrimental to your health.
Right.
And so that's what our team's all about, and doing a great job. Appreciate that.
Yeah, they're very, very passionate group of experts, and
a
great part of Nebraska Total Care.
For sure. So you touched on a lot of this, but are there any other services that Nebraska Total Care offers in care management, or anything else that you'd like to let us know about? That's
a big question.
I know.
A long answer, probably a whole podcast we could dedicate just
True.
to that.
Yeah.
I have worked in healthcare for a long time, and but most of that's been in hospitals. So this being my first journey in a managed care organization, I've just been blown away at the support and services that are available for people. So I think the best way I could answer that question is to say, we've tried to organize ourselves in kind of some mini teams because there's so many services that we could offer for someone. So for example, if you're diabetic, we have diabetic coaches. We have free blood pressure cuffs, gym memberships, Weight Watchers memberships. We are going to help you to get to the doctor. It's important that you get there and you get your eyes checked, make sure your blood pressure is well controlled, that your blood sugars are well controlled. And so that really requires that team of experts kind of behind the scenes working together. So we have ourselves organized in many teams. We have, like Adam referenced, teams around foster care, teams that are working with our members that are struggling with addiction, whether that's drugs or alcohol. We have teams working with our members that are awaiting an organ transplant. I mean, the list is pretty long. So, but I would say whatever someone's concerns are, call, reach out through the member services line and ask for care management, because we do have experts here to help you set your goals and improve your life.
Excellent. Well, as you can see, both Adam and Nancy are very passionate about their health care and about our plan. And their leadership has trickled down to every other person in our organization and piece of our staff, and we're ready to assist you in your healthcare journey at any time. Please don't hesitate to reach out to us. You can reach out to us by email. You can go out to the website, nebraskatotalcare.com, and find out more about all of the services that we have to offer. We have a customer service number. Our next podcast will be on maternal health. All that you need to know about staying healthy during pregnancy and delivering a healthy baby. So until next time, again, this is Dr. Chris Elliott from Nebraska Total Care. Appreciate you joining us. When you feel well, we feel well. Have a great day.